It's clear from our events that pharmacists and their teams recognise the challenges being faced by the NHS today.
How can we create a culture where the public are aware of and utilise fully the range of services available from their local community pharmacy, now and in the future? We need to improve public awareness of the services available from their local pharmacy.
Patients and the public are probably unaware of the full range of services that pharmacy can provide, and they do not have the natural thought process to use their pharmacy as a first port of call as opposed to their GP or the emergency department.
I think one of the key issues that we need to overcome is people's understanding of what pharmacy does and can do. There's so much that pharmacy does do in addition to essentially supplying people with their medicines.
There needs to be consistency across all pharmacies with a range of services provided.
For me, Call to Action is a brilliant opportunity to put ourselves in our patients' shoes, and I think what they want is a wider range of services, but to find those services in all pharmacies, not just in a few, and then they'll really understand what it is that pharmacy can do for them.
Pharmacies need to be viewed as a healthcare service, not just a shop or drugstore.
I feel very strongly that pharmacy has to look at the contract and renegotiate it in a way that favours our professionalism and our skill sets. We train people to a very high level, and then they get turned out into the high street where they don't really make full use of their skills.
By being a healthy living pharmacy, we become a community health hub, working within a larger structure with the support of GPs and other providers.
Pharmacies need to be better integrated into the healthcare community.
I'll see the future of pharmacy as being pharmacist-led, and what I mean by that is the pharmacist being at the forefront of all of the services offered, not just delegating. So, I mean, just checking prescriptions and becoming a prescription factory, I don't see that as the future. What I do see as the future is the pharmacist being a key member in all of the primary healthcare teams and pushing that forward to the patient. That's what I see as the future of pharmacy.
Thinking about where pharmacy needs to be in the future, I think we really need to think about not necessarily the existing setup, but actually where the key needs to the health system are coming from. If we really consider that, we need to look at particular patient groups such as the elderly, frail, and those with long-term conditions, and how we actually are amending our service to actually assist their well-being.
How can the way we commission services from community pharmacy maximise the potential for community pharmacy to support patients to get more from their medicines? General practitioners need to value the services that pharmacists provide.
I feel that GPs could be more informed of what services we could offer, and I believe, being a pharmacy technician, that technicians should be able to offer more as a service to help the community.
I think many practitioners would complain that they feel they're tick boxing a lot of the time, and if it were possible to work in a complementary fashion with pharmacists to try and coordinate management of the longer term conditions, I think there wouldn't be many GPs would be unhappy with that approach.
We need nationally commissioned services to provide consistency.
We would need some commissioning of quality national services that are ingrained in patient pathways. That providing a set of circumstances where sustainability of those services, investment in the delivery of those services and uniformity of provision allow the patients to understand more clearly exactly that they can expect from their pharmacy and from their pharmacist.
The management of medicines is a time-consuming activity. We've heard from patients today that many of them experienced being given a prescription for a medicine without actually being told the reason why, how they should take their medicines, or even more worryingly what the side effects might be. The new medicine services provided by pharmacies covers all of these aspects, and we know that it is valued by patients, and we know that this service actually helps to reduce medicines waste and help with patient concordance. The long-term future of this service is still not known. And what we would like to see is that there is a national commissioning of the locality services that are being provided up and down the country that we know give benefit to patients and the wider health economy.
What
What I would really like to see come out of the call to action is enthusiasm from everybody across primary care for community pharmacy, and see national development of the community pharmacy contractual framework.
We need to commission services that balance the supply of medicines with the provision of clinical services.
We know problematic polypharmacy is a real issue. Patients get very confused, and we know they get very confused if they're on 4 or more medicines. In my experience, I've seen patients who are on up to 37 different medications. How on earth can they manage? Community pharmacy can support them doing this through their long-term conditions programmes.
Well, I think pharmacy needs to move forward and look at what other countries are doing, such as in Australia, where we have home medication review, where pharmacists go to the patient's home and actually do a whole full profile and endorsed by the GP to do so, with the shared patient records as well.
Pharmacy needs to be seen as first port of call.
The most successful outcome from the pharmacy call to action for me would be for everybody to be thinking pharmacy first, and to use community pharmacy as the first port of call for self-care, minor ailments and management of long-term conditions.
We have our grandchildren to stay with us often, and they range from age 2 to age 9. And I've gone in there many times, and the pharmacist has given me advice, and especially on a Saturday when I can't get a doctor, and this was only a fortnight ago, given me good advice as to how to treat his earache and what I should do about it, and that's happened several times.
Absolutely excellent service.
How can we better integrate community pharmacy services into patient care pathways? Pharmacy needs a greater role in influencing the development of patient care pathways.
We believe the patient should be centre of everything, and we also believe that pharmacies should be better integrated into the National Health Service teams so that we influence the way pathways are developed as we move forward. We're also working with the commissioners to develop new services for pharmacy.
Community pharmacy needs to collaborate on a population basis.
Community pharmacy has such a huge potential to offer to their patients and to their medics and nurses working within the community, and can really help with medicines optimisation and bringing that forward. So come on, let's change the contract, let's change how things are funded within community pharmacy, and let's encourage community pharmacists to become fantastic clinical pharmacists as well.
Community pharmacy needs to integrate into the wider transformation and integration agenda.
What I'd like to do is to make sure that anything that we do or that we talk about the changing of the pharmacy design and implementation and delivery reflects what actually the community wants. We need to make sure that the patient's desires, needs and the community focus is embedded in any changes that we make.
Our pharmacy treating minor ailments has made a big difference to me. Part of my job is treating minor ailments, and quite often people have been to see the pharmacy during the weekend or bank holidays when we're not open.
Helping high-risk and vulnerable patients should be a priority for community pharmacy.
One of the key assets of community pharmacists is just that. They are embedded in the community. They are a non-stigmatised location where people go in and out of pharmacists all the time. They're a natural source of advice. They're a place where many mental health patients would feel more comfortable about accessing services, potentially, than they would from their general practitioner. One of the key advantages of pharmacists in this regard is in the absence of access times. Community pharmacists are just that, they're accessible.
Yeah, well, it would be great if you could just call in and get flu injections and minor ailments treated. That would be really useful. Yeah.
How can the use of a range of technologies increase the safety of dispensing? Pharmacy needs to invest in its IT infrastructure.
I think that one of the major assets that pharmacies have to offer are the data and the intelligence that it holds. Yet one of the frustrations that I've come across in commissioning pharmacists is the frustration that we have with the IT capabilities of pharmacists and the information networks and the data networks, the way that data is managed, the way that it's held, the way that it's processed into something meaningful. So investment into the IT of pharmacists would be fantastic.
We need standardised IT systems across healthcare, including pharmacy.
I feel that the support is different from different IT systems, and I would like to see I would say nationwide system that enable us to to get the most out of every service we do. I want it to be where we can do our claims for different services on that system. I want it to be so we can run audits on that system, so they are made to fit everybody's pharmacy, and that would make life so much easier and simpler.
Pharmacy needs access to summary care records.
Pharmacists really need access to summary care records. It is so difficult giving up-to-date advice to patients without having any knowledge of the background of their medical records.
Pharmacists need to use IT innovatively to better support patients.
We're trying to use our IT correctly and innovatively. We're using iPads to help patients in store. That can also help with language selection and also with leaflets, and help explain conditions to patients really, really well.
The continued rollout of the electronic prescription service has improved the safety and efficiency of dispensing.
The electronic prescription service continues to roll out at pace across Devon, Cornwall and the Isles of Scilly. This service is improving the efficiency and safety of dispensing and is improving communication between GP practices and community pharmacies.
We've moved recently to the electronic prescribing, which there's been some teething issues, but on the whole this has been a definite positive step, and I think this is going to be the future. It's here to stay for sure, and again it's something perhaps patients don't perceive the benefit, but logistics and efficacy of working, it's definitely been shown, I think.
I think we need to change our focus from quantity. I mean, since last many years, it's all been how many items we have dispensed, how many MURs we have done, how many NMS we have done. But actually, we need to think about how good we are doing these things. We need to focus on quality now, not quantity. I mean, whatever we do needs to be of best quality.
Community pharmacy offers significant opportunities to improve the health outcomes by ensuring that patients get more from their medicines.
Community pharmacy call to action. Think pharmacy first.